Boundaries and the advice reflex. In clinical work, advice often feels helpful. It feels active, it feels responsible, and it often feels relieving to the clinician. But in psychotherapy, the urge to advise is frequently a signal, not of patient readiness, but rather of clinician discomfort. Therapeutic boundaries are not about withholding care. They are about preserving clarity of role. When boundaries are clear, patients retain agency. When boundaries blur, responsibility subtly shifts away from the patient. Here's an example of an incorrect response. Here the clinician moves quickly into advice. His posture changes, his hands gesture, and the therapist begins to occupy the conversational space in an inappropriate manner. Although well intentioned, this response does something important. It replaces exploration with direction. Let's pause here for a moment. Advice often arrives before the patient has fully articulated the problem or understood their own ambivalence. In these moments, advice does not resolve uncertainty, it bypasses it. Let's take a look at a corrected response. Here, the therapist does less. His posture becomes still, his hands settle, and the therapist returns to listening. This is not withdrawal, this is containment. The boundary signals your decisions belong to you. When advice is withheld, something important happens. The patient re enters the problem. Ambivalence becomes visible, and reflection replaces urgency. Boundaries can create space, not distance. To summarize, it is important to avoid solving the problem for the patient. It is better to replace advice with guided reflection. After all, structure creates safety. Boundaries preserve agency. The therapist's role is not to rescue, but to guide. When structure is clear, safety follows. In psychotherapy, the most therapeutic answer is often a question that returns responsibility to the patient.